8 symptoms that affect you when your liver is overloaded with toxins. The liver is the most important organ in our body, and its functions are essential for maintaining a high-quality life. That's why you need to pay attention to any symptom that you might be experiencing in order to prevent, for instance, an overload of toxins. It's in charge of filtering blood in order to remove waste that the body doesn't need. At the same time, it plays a role in metabolic functions and secretion in the case of some hormones. It also carries out an important role in synthesizing carbohydrates and lipids, in addition to storing various vitamins that are essential for health. However, like other organs, it's exposed to a wide variety of factors that can interfere with its functions. If it already has to work ceaselessly to maintain clean, an overload of toxins can hinder it from doing its job to its best capability. This is why it's important to be cautious if anything appears unusual, addressing the symptoms as soon as possible. In this article, we want to highlight the top 8 of them so you won't hesitate in taking the appropriate measures when you identify them. Changes in urine and feces. Changes in the color of urine and feces can be a signal warning us of liver malfunction. While digestive or urinary conditions may cause these changes, a considerable number of cases have something to do with liver problems. The urine of a healthy person is pale yellow in color, while that of a jaundice patient is dark yellow. In the same way, feces that is too dark or pale can also be an indication that something isn't right. Abdominal swelling. While abdominal swelling is related to many health conditions, we shouldn't rule out a liver problem. Persistent stomach cramps, gas buildup and a feeling of heaviness are common among people who have a liver overburdened with toxins. Skin problems. The excessive toxins that accumulate in the liver usually result in negative and obvious consequences in the skin. Inexplicable irritation, dryness and acne are warning signs of problems that the liver is suffering due to an excess of waste. Although some external treatments can relieve or lessen symptoms, the liver needs to be detoxed in order to treat them completely. Acid and gastroesophageal reflux. Stomach acid and gastroesophageal reflux are common symptoms among those who ingest plentiful or excessive meals. However, sometimes we need to investigate the true origin of reflux, given that they might be a reaction to the liver retaining toxins. 5. Physical and mental fatigue. Physical and mental fatigue can be an outcome of daily physical overexertion or unhealthy habits. However, if fatigue is reoccurring and inexplicable, it might be a warning sign signaling liver problems. Lethargy, difficulties in concentration and physical weakness can be outcomes of the complications caused by toxins in the blood circulation. Liquid retention and excessive tissue inflammation can result in liquid retention caused by the hepatic system's malfunction. This symptom is quite common among patients with kidney disease, but it can also appear in the cases of an overworked liver. The majority of these cases see an obvious swelling in the limbs as well as in the abdomen. 7. Yellow skin. Yellow skin is a disorder known as jaundice, and it's caused by a buildup of bilirubin. The pigment is produced by bile, which is key in the digestive process, and it may build up in the bloodstream when it's too difficult for the liver to filter the blood's waste products. 8. Loss of appetite. Loss of appetite is a symptom that can appear in many sicknesses or emotional circumstances. However, It's wise to be cautious of such situations as it can sometimes indicate liver disease. What's most worrisome is that it can cause serious complications because it leads to nutrition deficiency. Are you experiencing any of the mentioned symptoms? If so, consider a detox diet to cleanse your body and drink more water along with purifying drinks. If the symptoms persist, contact your doctor.